Good afternoon, and welcome to the local Blackhawk County Emergency Management and Emergency Operations Center COVID-19 press briefing for today, May 14th. Today's press briefing is being offered to our local media partners via Zoom as well as Facebook Live. This is an attempt to encourage and protect our social distancing, our media partners, to improve our communication and our reach. For those of you that are joining us via Zoom, please understand that we're going to mute you when you come into the meeting. We will give you an opportunity to ask questions once all of our speakers have had the opportunity to speak. If you're on the computer, we ask that you raise your hand using that particular button or put your questions into the chat box. We do have facilitators here and moderators to help you with that. Dial-in participants will need to hit *9 in order to raise your hand, and you'll be given the opportunity to ask your questions that way as well. We will try and answer all your questions. However, if a question does not get answered during the press conference itself, we will forward that question to the appropriate person to ensure that it gets answered and sent to you at a later time. Today's press conference is going to be reflective of the governor's loosening of restrictions, and we've brought particular experts with regard to what some of those restrictions are, as well as some of our local mayors to discuss the impacts on their local municipalities. So today we will start as we normally do, and it is my pleasure to introduce to you our Incident Commander and Director of Public Health, Dr. Nafissa Cisse-Egbuonye.
Good afternoon. As of Thursday at 12:30 p.m., there is a total of 1,783 reported cases. We have 31 deaths. Of our deaths, 80% of the individuals were age 61 and over. Of the reported cases in Blackhawk County, we have 993 people who recovered. Of the recovered, 87% are between the ages of 19 and through 60. We have had 6,290 individuals tested in Blackhawk County. According to Governor Reynolds' proclamation, salons, barbershops, and massage and tattoo establishments are to reopen throughout Iowa in a limited fashion with appropriate public health measures in place. It also permits restaurants, but not bars, fitness centers, libraries, and racetracks to reopen. These changes are effective at 5 a.m. on Friday, May 15. Mandatory requirements included in the governor's proclamation must be implemented and enforced. Restaurants, it's important that you limit indoor and outdoor seating capacity to 50% of normal operating capacity. Limit group size seating to no more than 6 people. Arrange seating to provide a minimum of 6 feet between tables. Disallow customers self-service of food or beverages, including buffets and salad bars. Fitness centers, it is important that you limit the number of customers present to 50% of its maximum legal occupancy. Equipments must be spaced to at least 6 feet apart to ensure that more closely spaced equipment is not used. And any group activities or classes must be limited to 10 or fewer people, and all people practicing must maintain a distance of 6 feet apart at all times. Any facility providing direct services to clients such as salons, barbershops, massage therapy practices, medical spas, tanning salons, and tattoo parlors should limit the numbers of customers present to 50% of its maximum legal occupancy. You must operate on an appointment basis to ensure that the public is not gathering in the waiting area, and all shops must ensure that all customers are at least 6 feet apart when performing services. We also have additional resources for businesses on our website, blackhawkcovid19.com. Businesses, please take your time to reopen safely. Make sure that you have the proper structure that allows for social distancing of employees and customers, increased hygiene practices, and other public health measures to reduce the risk of transmissions. Businesses, we've had a lot of questions and also concerns, and I just want to state that the Blackhawk County Health Department is here to assist you all. So any questions or concerns that you may have in implementing these measures, we are here to help you and to support you to reopen safely. I know that this is a scary time for both businesses and customers, but I trust that we can work together to ensure the safety of the employees and the customers. Because we've also received a lot of questions regarding bars and restaurants, I have Jared Parmater, the environmental health manager, that will provide clarification for restaurants and bars and what is expected of these establishments. We continue to see a decrease in our numbers, which is a good sign. However, I caution everyone on the importance of continued preventative measures. One, social distancing is critically important. Wearing a cloth face mask at all times, or when you can't practice social distancing in particular, I highly recommend you wearing a cloth face mask. Frequently washing your hands for at least 20 seconds. I know at the beginning we talked about that, but this is also a reminder that this is still important. So please continue to frequently wash your hands for at least 20 seconds and remember the happy birthday song when you're doing that. Disinfecting frequently touched surfaces are still very important, and all these practices are still important because we don't know much about COVID-19. We continue to learn about COVID-19, and my ask to the community is to continue to practice these preventative measures because that is what is going to continue to decrease the spread of COVID-19. Again, business owners, please take your time to open safely for your own health, your employees' health, and the community's health. Thank you.
As Dr. Egbuonye alluded to, we are now going to invite up the Environmental Health Program Manager from Blackhawk County Health Department, Mr. Jared Parmater.
Thank you and good afternoon. Dr. Egbuonye hit on several of the key items of discussion here today, but I'd like to reiterate a few things. Of course, starting at 05 tomorrow morning, restaurants are going to be able to open, but that does not apply to bars as well. So I think one of the important things to do right away, and based upon conversations that we've had in the community over the last 2 days, to get a solid definition of actually what a bar is. So I'm going to read directly from the governor's proclamation on that, just so that there's some clarity out there. And people will hopefully know whether or not this applies to them. So per the governor's proclamation, for the purposes of this section, a bar is an establishment where a customer may purchase alcoholic beverages and in which the serving of food is incidental to the consumption of those beverages and is limited to the service of ice, snack foods, and the reheating of commercially prepared foods such as frozen pizzas, prepackaged sandwiches, or other prepackaged ready-to-serve products. So what this really is doing for us is identifying those key services that these establishments actually undertake. Now, expecting these establishments to notify or to note whether or not they are a bar, really the question falls back on this. Is your primary service you provide the community drinks? Is that what you're primarily doing, or do you also have an extensive kitchen that is, supplying food as well? Another thing to take into consideration here, and this goes for the establishments as well as the patrons out there, is that the expectation behind this is, yes, let's go out and enjoy our favorite restaurants in the community. It's fantastic that these are reopening, right? But understand that they're opening under a limited model, right? Nafissa had mentioned that we're opening at 50% capacity, and there's a few other mandates that these restaurants have to meet as well. Social distancing, arranging seats between 6 feet between tables, making sure that parties of no greater than 6 are in the establishment as well. So those are key things to recall. The Department of Inspection and Appeals actually has put out some strongly recommended guidelines that go along with this. And this document can be found on multiple places. You can find it on the Blackhawk County COVID website. You can also just search for the Department of Inspections and Appeals. For establishments, you'll be getting a couple of different emails. You should see something from one of our inspectors here today, if you haven't already. And the Department of Inspections and Appeals is going to be pushing out this information as well tomorrow. I do caution people to understand, though, patrons, establishments, when we're going out and enjoying these establishments, you're enjoying your favorite restaurants, please keep in mind that the guidance behind this is, as you come in, you place your order. Sure, enjoy drinks with your order, as much as you'd like. But please note that once you've stopped consuming food, once your meal is over, the expectation is really that you leave the establishment. Okay, and so that's something we'd like to reiterate. That should not just be incumbent upon the establishment themselves. Although the expectation is that they are moderating that. But we ask the public to keep this in mind as well. So that'll be all. Thank you.
Thank you, Jared. So now it's my turn to be bad cop for just a minute, because the question that I think is following up on that is so what? So what if we don't? So what if we choose to open the bar? So what if we choose to patronize establishments that should not be open? Those kinds of questions, right? We had a long conversation and a meeting this afternoon with the county attorney, city's attorney, and making sure that most all law enforcement officers in Blackhawk County are on a similar sheet of music. One of the first things that I will point out, and this message is reiterated from all law enforcement in Blackhawk County: we do not want to be the bad guys. That's not our goal. But in meeting with the Department of Health, meeting with the county attorney, meeting with the city attorneys, and meeting with local law enforcement leaders, understand that there are enforcement capabilities with regard to governor's proclamations. Under Iowa Code Chapter 135, there are charges that can be conveyed both to establishment owners as well as to patrons for people not following the governor's proclamation. While that's not what we want to do, we do recognize that it is the governor's intent to have a measured approach to opening back up the state of Iowa. And that measured approach is for one very important reason. And it's not to just completely jumpstart the economy. It's to have that measured approach so that we don't jumpstart an economy while at the detriment of beginning a secondary surge of the virus. And so we're trying to do this in a pragmatic way. We're trying to do this in a way that doesn't make law enforcement the heavy. So we are asking for both business owners as well as patrons to do this with a modicum of responsibility, with an understanding of our obligation to enforce law and the governor's proclamation, and with an understanding that your own safety is a critical and paramount part of what we are trying to do here. Public safety is a unique role that we provide every single day. This is just a unique arena for us to provide it. And so please help us with regard to that. Understand that for establishments that may not choose to follow those rules, Chapter 135 may not be the only thing that may be in play. Through the Department of Inspection and Appeals and the Alcohol Beverages Division, your liquor license may be in play as well. And so that's not something that we do at a local level. That is something at a state level that could be pursued as well. But I mention it because I want everybody to go into this eyes wide open. We're all about transparency. Patrons, charges of trespass, interference, all those kinds of things that we've talked about before. Again, we don't want to go there. We do have faith and trust, just like the governor has said she trusts Iowans, we trust Blackhawk Countyans, and we want to make sure that as people start to open these businesses back up and that we are able to start enjoying some freedom of movement and some responsible application of the ability to exercise again and be free to move about again. We want you to do so responsibly and certainly help us, particularly in a time when we are trying to prevent the spread during our surge within the most vulnerable of our populations right now, and that's long-term care facilities. So anything you can do to help us curtail that spread is critically important to us at this point in time. So with that, I will get off the negative Nancy side of the house, the bad cop side of the obligation that I've been voted to play. And I will introduce to you the elected officials in the room, and we'll start off with the elected mayor of the city of Evansdale, Mr. Troy Beatty.
Good afternoon, and thank you for the opportunity to speak. To start off, I want to thank Dr. Nafissa Cisse-Egbuonye, Josh Pecora, along with the entire public health team in Black Hawk County. They have been working tirelessly to track this virus to keep the public informed. The local officials are next on my list of thanks. Even though we did not agree on everything, we did put a considerable amount of time and effort into addressing this pandemic. The communication has been nothing short of phenomenal, and this included hospitals, long-term care facilities, community partners like the Salvation Army, Food Bank, and many others. Thank you all for your efforts. The following thank you goes to my community of Evansdale. As we communicated information over the last few months, it has not always been well received. This was my welcome to politics moment, as you would say. This was all in an effort to keep as many safe as possible with information that we had at that current moment. The constantly evolving nature of this pandemic required multiple pivots, and thanks to my Marine Corps experience, I've mastered that pivot. We use the term semper gumby, meaning always flexible, and that served very well during our current times. Everyone has done the best they could, and I definitely appreciate that. As Evansdale prepares to loosen restrictions, it makes me reflect on those essential businesses that have been open in my community. From the local fairway with staff that has been exposed to countless people, to the gas stations and other businesses making contact with people daily, my city, like many others, also has a lot of essential personnel working. They put on their best face, went to work every day, and also please not forget the medical field folks on those front lines. These efforts were handled with poise, grace, and we cannot thank you enough. The next call out is for the family businesses eager to get going. They have been hit the hardest, and I'm hoping that you get the relief you need in the coming weeks. My thoughts and prayers go out to those in my city, our county, state of Iowa, and the entire U.S. With that said, I plan to loosen restrictions on City Hall by the middle of next week, and will continue to monitor the current landscape. These announcements and plans will be formalized by sometime Tuesday next week, 5/19. As we move forward, I want to remind everyone of why some of these steps were taken to begin with. As mentioned before by others, these steps were never to 100% prevent the spread of this virus. It was to limit a major surge or flatten the curve so we would not overwhelm our hospitals. As we moved through this and we increased testing, we saw numbers spike as we would expect. As of currently, there is no cure or vaccination for this virus. As of a few days ago, our MCC Region 6, which Black Hawk County is a part of, we had over 70% of our ICU beds available and ventilators, which is a positive sign. Iowa, by population, is much better at social distancing versus in New York City due to the lack of the major public transportation, high-rise buildings that puts thousands of people in tight quarters, and that makes a big difference. I wanted to use this information to inject some realism. Our long-term care facilities have been using PPE, and they have unfortunately not been able to prevent the spread. We are fighting a virus that we cannot see, smell, or feel. Those places have staff that have worked tirelessly to prevent this, and still it found a way. This is unfortunate, as even one death anywhere is one too many, and my heart goes out to those that have been infected. Navigating these waters was never required any sort of political stance, and for those that have reached out that felt alienated by some of the past messages, you have my apologies. This message of unity is what the public wanted, and this is what you are seeing today with the other fine mayors in Black Hawk County. Please remember it is your choice how you respond to this reopening. If you are not comfortable, you are not required to put yourself at risk. I believe we are also a country of rights, and those that want to open and those that want those services should be able to engage in those activities. As we move through the remainder of 2020 and beyond, I am encouraged by the partnership by all parties at the table. In closing, I want those at risk to still heed the warnings. Please keep using a mask to protect yourself. Please keep social distancing. Please continue to let others make those essential errand runs as much as possible. This virus has proven that those at risk still need to be cautious for their own safety. Thank you.
Thank you, Mr. Mayor. Our next mayor is George Wessels from the city of Hudson. George?
Thank you, Tony. Hudson does not have the epicenter of the Black Hawk County outbreak of COVID-19. We don't have Tyson Meats. We don't have long-term care facilities. For businesses, we don't have malls. We don't even have a restaurant or a barbershop. But we're impacted. We have churches, we have a school, and we have kids and adults of every age. This COVID-19 pandemic affects all of us. Maybe Hudson residents don't like being referred to as a bedroom community, but that is what we are. Many of our residents, including me, are employed in Cedar Falls or Waterloo, and then go back home to our families. We all want to get back to the day when we can see the kids on the playgrounds and the ball fields, as well as enjoying our new splash pad in our city park. For the better part of the past 2 months, I've joined a daily call coordinated by the Emergency Operations Center, along with normally 40 to 50 others who've spent 60 to 90 minutes each day sharing information on how the virus was spreading and what we needed to focus on to do our parts in slowing the spread and helping those impacted. Through press conferences and other communications, we've attempted to get all the residents to focus on slowing the spread. As the saying goes, we're all in this together. The fight's not over. We all want to get back to life as normal, or as normal as now as possible. We want to be able to enjoy a nice restaurant meal. We want to be able to attend our church. We want to be able to visit with our friends other than through Zoom. To get to that normalcy as soon as possible, I implore all the residents of the Cedar Valley to continue what we have been doing in support of the Cedar Valley and the state of Iowa. Continue social distancing wherever you are. Wear a face mask when you can't. Do this not only for yourself, but also for your neighbor and anyone else you encounter. And continue to stay home or work from home as much as possible. Thank you.
And our last two mayors are exercising social distancing, so they will be participating via Zoom. The next mayor is the Honorable Mayor from Cedar Falls, Mr. Rob Green.
Thank you, Sheriff Thompson. Now, I won't cover the same ground that Mayor Wessels and Mayor Beatty said, except just to say thanks to all in the community who have been part of working through this time into a recovery effort. It's definitely no small task, and we have a lot of work ahead of us. Cedar Falls businesses and organizations are reopening tomorrow, and the City of Cedar Falls will follow suit starting on Monday, May 18th. You should see details in the news about this shortly, but here are the basics. City Hall will be reopened to the public for lobby window service, but not in-person meetings. Residents are encouraged to continue to use electronic processes as much as possible, such as phone, email, and web forms. The Fitness and Recreation Center will restart operations at noon on Monday. It'll only be open to members during that time and will be limited to 40 users at a time, which is well below the 50% capacity restriction in the governor's proclamation. The Hurt Center for the Arts and the Cedar Falls Public Library will remain closed to the public, and their summer camps have been canceled. Both the Hurt Center and the library are working on virtual programs and potentially some short in-person programs later in this summer, so stay tuned. And the Visitors and Tourism Center is also expecting to open with restrictions on May 26th. Our goal in this initial recovery phase is for a closely monitored return to in-person services, both in business, retail, and government. We'll make adjustments as needed based on what the experience is in the weeks to come. During that time, I would just like to caution our viewers here to think critically about the information that's being presented to you in all forms. It's healthy to have a bit of skepticism when dealing with this deluge of competing information that's being fired at us every day. It's being called an infodemic. That said, I'm relying on the information provided by the Centers for Disease Control, the Black Hawk County Health Department, and the Iowa Department of Public Health. It's really easy, too, to be sucked into this 24-hour news cycle, and I encourage you to take a break from it when possible to regain some perspective about your own life, your loved ones, and your community. Overdosing on media isn't good for our mental health. Finally, be careful in your Google searches about this pandemic. I guarantee, whatever your opinions, you're going to find 50 articles that back up your view. That doesn't mean that those opinions are right. Be a discerning media consumer, and as Ben Franklin said, we should all be a little skeptical of our own infallibility. By working together, we will be able to get through this recovery phase of our pandemic. Thank you.
Thank you, Mr. Mayor. And our final speaker today is the Honorable Mayor from the City of Waterloo, Mayor Quentin Hart.
Good afternoon, and thank you, Sheriff Thompson, Dr. Nafissa, and all of the Emergency Operations Center, which is comprised of not just professionals from law enforcement, but it's also elected officials, schools, long-term care, hospitals, child care, emergency management services, and everyone else that I may have missed. And these are people, yes, people on the calls all have titles, but first and foremost, they absolutely care about this community and in community. And in these times of COVID, caring and compassion are just what the doctors have ordered. But in addition to the caring and compassion, we have been tested on every side. We have shared real-time information, made sure that when we had data and information, our public had the information without bias, lags, or delays. And that's been, whether it's been good news or it's been bad news, but all of us have done our best to keep this community informed. And as state government officials began the process of relaxing closures and ramping up openings, I would like to remind everyone in our community that our threat has not diminished. The ability to inhale or exhale the virus, the amount of time that it lives on surfaces are still the same as they were before we began the closings. But the fact is not to deter you on your decisions to move forward, because at some point we have to push ahead. But this fact is to let you know that there is still a risk, and by using data-driven decisions combined with best practices, we make our community safer than some of the arbitrary dates. And in addition, we must understand that having our local mayors in attendance and speaking should help you to realize that this is not just a Waterloo problem. It's not just a CF problem, not an Evansdale, not Hudson, Gilbertville, Raymond virus alone. This is a challenge that needs to be met head on by all of us in this county. And our challenges and successes are all internet connected together. Because remember, every day, nearly 30,000 people come to the city of Waterloo for work, while 14,000 from the city leave for work. Every day in Cedar Falls, nearly 10,000 leave the city for work, mostly into our surrounding communities. And these numbers just don't stop at our two cities. They also include all of our surrounding communities. So we are all tied together. And that is why we have to continue our progress as a Cedar Valley and the entire Black Hawk County. And in addition, I know that we will. Remember, there are no plexiglass barriers between cities that will protect one city and keep us safe. It is the barriers between you and the virus that will continue to help the positive progress we have seen. It is your ability to implement best practices in your place of employment or following CDC guidelines when opening your business. It is following those rules. It's understanding that what you do has an impact, not just on you, but also to others around you. Our personal decisions have a great impact on our overall collective strength. We are the Cedar Valley, and we are Black Hawk County strong, and we are just starting to make progress. So let us not test that progress because of pride or impatience. Our goal should be to move forward and not backwards, move forward together and not backwards individually. And in closing, I think Henry Ford said it the best: coming together is a beginning, working together is progress, and staying together is success. So let's stay together, and make decisions that are positively impacting the long-term safety of this community. Thank you.
Thank you, Mr. Mayor. That concludes our prepared remarks pending your questions for today. Amy.
Can you talk about how many of the cases that we have are 81 plus? I know that they've been talking about that. You mentioned the 61 and over.
Nafissa, the question is regarding the age demographics, not just 61 and above, but breaking it down to the 81 and above demographic.
I think that's on our website. Hold on, let me get it for you. Gosh.
We'll get that question for you here momentarily. Next question.
Perfect.
I had a question about spot checking. Will there be any spot checking of businesses such as restaurants, bars, and other sorts of businesses?
Both locally, regionally, as well as state assets will be doing spot checking, yes.
Does that include both the Black Hawk County Sheriff's Office as well as the Waterloo?
Local agencies, ABD, DIA, there's agents that will be working.
We have a question from Kate Payne from Iowa Public Radio. She is unmuted, Kate.
She's not unmuted
Oh.
yet.
Now you're unmuted, Kate.
Okay, thank you. So I'm curious what recommendations are being made to businesses as far as their use of PPE, and will they be able to get PPE from county supplies?
I can answer the second part of that question with regard to PPE from county supplies. The answer is no. That's not what the PPE is for. But with regard to recommendations for PPE, we'll have Jared maybe answer that.
Thank you. That's a great question. So in both of the items that we discussed today, the restaurants opening up, as well as the direct services. So there is recommendations on PPE for that. So for restaurants, the recommendation, of course, is the distancing, social distancing, but there are recommendations for increased cleaning of all surfaces. So those could be, anything from food contact surfaces to non-contact surfaces. The recommendations are always there for increased PPE, masks and gloves. Now for direct services, that actually increases a bit. So with that, they're looking at not only mandating like an administrative, or mandating people signing in and scheduling an appointment, but they're also focusing on both the direct service provider as well as the patron, utilizing masks and gloves. So, or at least masks for the patron. So, there are some definite recommendations on that, and you can find those recommendations on our COVID-19 website. Any questions? Thanks.
So Amy, in terms of this is for, your question was for the total number of cases, the percentage of 81 and over, it's 1.5%. And some of that data also is on blackhawkcovid19.com. We update them.
Do you have a breakdown of deaths as far as that age group?
Yes, so that for deaths, it's 41.4%.
Kate Payne has another question from Iowa Public Radio. Kate, you are unmuted. Maybe.
Not yet.
1 second. Now you're unmuted.
Okay. Sheriff, as far as the enforcement, is this potentially a misdemeanor offense, or what are we?
It is a misdemeanor offense under Chapter 135. It is a misdemeanor offense. And then again, we hope that doesn't even go to that level. That's not really where we want to be. We're really, and it was echoed by the health department, Dr. Nafissa. It's been echoed by the county attorney. It's been echoed by every chief that we've talked with. It's been echoed by the city attorneys. We want to work cooperatively with these businesses. We recognize that there are businesses hanging on by a string right now. And so the importance for us is to try and help them do the right thing, in the right way, and make sure that as we ease into the lifting of these restrictions, we can do so responsibly as well as pragmatically. And so while I had to be the heavy and I was elected to be the bad guy and spread that information, the reality for us is we really don't want to be that person. We don't want to be the person out there doing spot checking, calling gotcha, writing citations, or God forbid, taking people to jail or doing any of those kinds of things. We do ask for cooperation. We do ask for understanding. We do ask for pragmatism. We do ask for real, just removing yourself from that 5-foot view and bringing yourself back up to that 50,000-foot view and taking a look at the impact that could be had by doing things irresponsibly. And that's really why the governor's doing what she's doing in this way, and that's why we're trying to enforce it the way we're enforcing it. So please, we ask that you work cooperatively with us. But yeah, it would be a misdemeanor offense that would be enforced unless other things apply, unless there's a continuing level of non-cooperation, unless there's other conditions that apply, once we arrive, if the Department of Inspections and Appeals gets involved or whatever, it could go a whole nother direction. So yeah, go ahead.
We have a question from CBS Evening News. Is there an update regarding the number of cases linked to the Waterloo Tyson plant?
No, there is not. This is the number that we published about a week ago is current.
I had a question. You mentioned you've been hearing from a lot of businesses coming to you with concerns and questions. Give us a sense of, are these businesses wanting to open and just wanting to do it the right way, or are they worried and not really wanting to open at this time?
It's a combination of both. I think businesses also, like Sheriff Thompson said, the economic impact, they're feeling that as for even our entire community, businesses help make a community thrive. So there's that aspect, but there's that aspect of also, if I do open, how do I reopen safely? And my ask is, and my message is that we will be partners with them, and hopefully they are comfortable to reach out to us and whatever questions. We'll have a business meeting on Monday from 10 to 11 with roughly about 70 businesses that are going to attend this virtual business meeting, and that is it's a Q&A session. Just for us, our responsibility is to listen to them and also help them be able to implement the proper measures that are necessary to prevent the spread of COVID-19.
Is that meeting public? If other businesses wanted to join on, how would they do that?
Yes, so that comes from the Grove Cedar Valley. And so she's...
We have another question from Kate Payne from Iowa Public Radio. Go ahead, Kate. You're unmuted. Maybe. In a minute.
Hey, Dr. Egbuonye, for you, we saw in Lynn County there were reports that about 10% of their Test Iowa results were inconclusive. I'm curious, as far as the Test Iowa testing that was done in Black Hawk County, have you heard anything about those results and their reliability?
No, we have not for Black Hawk County.
Okay. Will those results be reported to you at some point, or is that just going through the state?
No, those results would be reported to us as well.
Okay. So they just haven't come in yet?
Mm-hmm. Yes. And if they have, we have not received any results that are inconclusive, is what I'm saying.
Okay. Okay. So the results have come in, but they're conclusive, I guess.
No, we have not received any results, but we also haven't heard that there are some issues with our testing for Black Hawk County. Okay,
got it. Thank you. And then another question for you about serology testing. I'm curious, how is that testing being implemented? Who's doing that testing? And do we know what company it's coming from?
So for serology testing, the results that we have gotten has been from the facilities such as Tyson that has done those testing. And I can also, Joshua Pecora can also come up here and also provide you more details in regards to that.
Hello. In regards to the question about serology testing, as Nafissa said, those serology testing was used for the on-site testing at Tyson, as well as has been used for the testing done with long-term care facilities that are seeing cases in their residents. Long-term care facilities are receiving those tests from LabCorp and then collecting those results and then submitting them back through LabCorp to the state.
And do you know which company those are supplied by?
So LabCorp uses a variety of suppliers in order to get the numbers needed for the long-term care facilities. I couldn't tell you which facilities receive supplies from which suppliers or a breakdown like that, but they pull from a number of suppliers to meet the needs of the long-term care facilities.
And there's been research into the reliability of those results and a lot of questions about whether they're false negatives. Does the county have concerns about those results, and are there efforts to validate those somehow?
So I can't speak to the efforts to validate the serology testing or the ongoing evaluation of testing for this virus. This comes with the territory of a new virus as new tests are developed and go through certification and then get out into use, and issues like that come up. It's part of the ongoing process, and I can't really speak to that on the lab side. I can just kind of go off of what guidance we have from the state health department and how to use those results. And the way we use those is if by the test that's run, they get they have the level of antibodies to declare it a positive result. We rely on that laboratory interpretation and we act on that positive as it is reported to us as a positive. All right, thank you.
Kate, you've been unmuted.
Okay, thanks. Another follow-up question on the serology, Josh. So one of the questions is about immunity, potential immunity based on these antibodies. So I'm curious, when people in Black Hawk County get these results back from the serology, are they getting any guidance about that, about potential immunity?
So what we use the serology test to determine is it indicates recent and past infection. So that's what that serology test is indicating, that this person had been infected with the virus, had been exposed to the virus. It's not a test for immunity. The immunity issue is something that's being very closely studied at the federal level, and that's something that's still being debated, and I can't really comment on that. The hope is that there is lasting immunity after someone has been infected. The level that is, how long it lasts, all those details are still being determined with this new virus.
I had a question if there have been any more infections in the jail or among jail staffers. I know we heard some negative news coming out of Polk County today.
Oh. Well, thank you, Sheriff Kevin Snyder, for taking the heat off of me. No, to date, our protocols still stand. In fact, the fact that the measures that we have taken, we're able to isolate very quickly on the one subcontractor that works in the kitchen, the one subcontractor that works in the medical department on third shift, certainly worked. And we're able to both limit exposure as well as lock it down quickly. So we certainly rode a nervous 14 days during that period of time, but we have had no more positive tests. We had several people tested, but no more positive tests.
Kate Payne has a question from Iowa Public Radio. Kate, you've been unmuted.
Thanks. So a follow-up on that, in other correctional facilities across the country, folks have found that a very high number of incarcerated people are asymptomatic and they're only catching those cases once they start testing proactively. Are there plans to do some of that aggressive testing of everyone in the Black Hawk County Jail?
Right now, there are no plans to do that simply because, again, the state hasn't changed their testing protocols at this point in time. We are still taking temperatures twice a day. We are still monitoring our inmate population, which is, for all intents and purposes for us, a relatively closed herd. We are not introducing new arrestees into our inmate population. They are isolated for a minimum of 14 days in their own pod, in their own wing. So the protocols and procedures that we have in place essentially have kept isolated those folks from well before the spread even getting to Iowa. So what has essentially happened is people have left the jail while people have not been introduced into that inmate population, and anybody that has not been introduced into the general population of the inmate living area. They've been introduced into their own quarters, into their own separate area. So while continuing to monitor, and again, we've got 24/7 medical and mental health care on site at our jail, which is somewhat unique in the state of Iowa for a county jail. We're not to the point where we are even considering a mass infection testing protocol simply because we don't meet criteria to make that happen at this point.
I wanted to ask about the long-term facilities. Nafissa, you had noted that, and the state has noted that we have 3 reported outbreaks and you were monitoring 3 more. Has that changed?
No, that has not changed.
All right. Pending no further questions, that will conclude today's press briefing. I thank you very much for your attendance, and we will see you again on Monday afternoon at 3:30. Thank you so much. Be safe.